Do not check blood pressure on an arm that has an AV fistula for dialysis patients, a mastectomy, a weak or contracted arm, or if they have an IV site or a PICC line. Remember, no smoking, no exercise, no caffeinated beverages, and no alcohol 30 minutes before checking a patient's blood pressure. Make sure that the patient uses the restroom before getting their blood pressure. Also make sure that they're sitting upright with their back straight and supported. Make sure that the patient is positioned properly for blood pressure. Make sure that the arm is resting at heart level with the palm up. Make sure that the legs are uncrossed and the feet are flat on the floor. Also make sure to put the blood pressure cuff on the correct side. Some people make the mistake of putting it on the wrong side. So you're not going to put on the blood pressure cuff on this side. You want to make sure you're on the correct side where you see the arrows pointing at the brachial artery, either the left brachial artery or the right brachial artery. And you can also tell you're on the right side because you're going to place the gauge over here. Here's a trick I would use if the blood pressure cuff is blocking the gauge. Also keep in mind, if the cuff is too small, it will give a false high reading. If you use a cuff that is too big, it will give a false low reading. Make sure that the tubing is not rubbing against each other. Make sure to wrap the blood pressure cuff on bare skin and not over clothing. The earpieces of the stethoscope should be facing towards the patient. When using a stethoscope, make sure that you tap on the diaphragm to make sure you're listening on the correct side. One of the mistakes that I see some people make is that they place the stethoscope on a patient's brachial pulse and try to listen for carot cough sounds. But in order to hear the carot cough sounds, you must pump up the blood pressure cuff. When doing blood pressure, don't forget to put the diaphragm on the brachial pulse. Make sure that you are in a quiet space. Also make sure that the patient is calm before taking the blood pressure. Encourage the patient to rest for at least 5 minutes before checking the blood pressure. When they're getting their blood pressure checked, make sure that they are calm and they're not talking. Try not to release the valve too rapidly. Otherwise, you'll have a difficult time hearing the carot cough sounds. Make sure to release the valve slowly. I'm right-handed, so the way I remember is righty-tighty, lefty-loosey when releasing the valve. So to release it, I will turn to the left to release the valve. And if it's too fast, I will turn it to the right, righty-tighty, to close the valve. If the reading looks off, make sure to double check just in case. If taking the reading for a second time, make sure that you give the patient's arm 1 to 3 minutes to rest.